Ever had that dull ache in your upper teeth that makes you wonder, is this a sinus infection or another tooth trying to ruin my week? You're not alone. Thousands ask this same question every month, and for good reason. Sinus pain and tooth pain can feel almost identical. Welcome to my channel. Today, let's break down the subtle clues that tell you whether to call your dentist or your doctor. Why sinus and tooth pain feel so similar. To understand why these two pains are such convincing imposters, we need to take a quick trip inside your face. Don't worry, it's a short one. The roots of your upper back teeth, especially molars and premolars, sit just below your maxillary sinus. Think of them as nosy neighbors living right under your nasal floor. When your sinus lining swells during a cold, allergy flare-up, or infection, it presses on the roots of those teeth. The result? Tooth pain that isn't really from your tooth at all. So yes, your sinuses can literally borrow your toothache, like that one friend who borrows your phone charger and never returns it. Clues: it's sinus pain, not a dental problem. Here are the telltale signs you're dealing with sinus pain, not a dental issue. Keycap 1: it affects multiple upper teeth. If the ache feels spread out, like 3 or 4 teeth hurt at once, that's a big clue. Dental pain usually picks one favorite tooth to torture. Keycap 2: it changes when you move your head. Try leaning forward or lying down. If the pressure increases, your sinuses might be the culprit. Teeth don't care about gravity, sinuses do. Keycap 3: you've got sinus symptoms. Congestion, postnasal drip, facial fullness, or a recent cold. Those are dead giveaways that this pain's coming from above, not below. It's dull, achy, and not triggered by temperature. Sinus-related pain is usually constant and throbbing, not sharp or sensitive to hot or cold. Think of sinus pain as that friend who complains about everything all day, while tooth pain is the drama queen who screams the second you sip ice water. Clues: it's real tooth pain. If the pain feels more like a laser beam than a fog, it's probably dental. Keycap 1: one specific tooth is the villain. Dental pain is usually pinpointed. You can almost name the exact tooth, like, yeah, that back molar on the left, second row from the exit. Keycap 2: it reacts to hot or cold. Sharp pain when you drink cold water or hot coffee. Classic nerve sensitivity or inflammation, not sinus pressure. Keycap 3: pain when biting or chewing. If biting down feels like a tiny electric shock, you might have a cracked tooth, cavity, or early infection. Keycap 4: no sinus symptoms. If your nose is clear, no congestion, and the pain's laser focused, the problem's probably dental. Tooth pain loves attention. It's dramatic, immediate, and specific. Sinus pain just loiters around, making your whole face feel heavy for no reason. The overlap zone. Here's the tricky part. Sometimes it's both. A dental infection in an upper tooth can spread upward into the sinus, and a sinus infection can irritate the nerves of nearby teeth. This overlap is why misdiagnosis happens so often. Some people even get a root canal for what was actually a sinus infection, or take antibiotics for what needed a filling. How to know for sure? If you're not sure whether it's your sinuses or your teeth, here's the plan of action. Step 1: see your dentist first. They'll check for cavities, cracked teeth, gum issues, and may take an X-ray. Step 2: if your teeth check out fine, see a doctor or ENT. A quick sinus exam or scan can confirm infection or inflammation. Step 3: if both agree it's sinus-related, saline rinses, nasal sprays, or short-term decongestants often relieve pressure. If it's dental, expect treatment for decay, nerve inflammation, or grinding. In short, if your tooth hurts, blame your nose. If your nose is clear, blame your tooth. And if both hurt, well, welcome to adulthood. Sinus pain and tooth pain may feel alike, but your body always leaves clues. You just have to know where to look. If this video helped you decode your pain mystery, tap that like button, subscribe for more dentist-approved tips, and share this with someone currently Googling tooth pain or sinus pain at 3 a.m.